Introduction to Art Therapy. Introduction to the module. This module provides an introduction to the concept of art therapy, providing historical insight into the therapeutic practice. The module outlines some of the important aspects of art therapy and tests you on these concepts. It also discusses some of the important figures in the development of art therapy. Topics to be covered in this module are: definition of art therapy, basic principles of art therapy, development of art therapy, Rorschach-Inkblatt test, art in relation to mental health care, the therapeutic application of art therapy in mental health care. What is art therapy? The British Association of Art Therapists, BAAT, defines art therapy as a form of psychotherapy that uses art media as its primary mode of expression and communication. The therapeutic technique, therefore, utilizes art as a way to address emotional issues. Art therapy is used as a solution for people of all ages. Young people, adults, and the elderly have all benefited from art therapy interventions. The technique can also be used to treat a wide range of difficulties and disabilities, including emotional, behavioral, and psychological problems, learning difficulties, physical illnesses. When practiced, art therapy can be applied to groups or on an individual basis. Those involved do not require any artistic ability or previous experience in producing art. Art therapy has been influenced by psychoanalysis. The technique draws on attachment-based psychotherapy, and its proponents have developed a wide range of approaches to its application. These include mindfulness techniques, alongside more traditional psychoeducational programs. Neuroscience research has also been conducted in this field. The BAAT has been actively involved in researching and exploring art therapy since it was founded in 1964. The organization runs a range of courses and tailors its interventions to the needs and circumstances of individual clients. Basic principles of art therapy. Art therapy can be considered a diverse practice, which addresses many deep psychological problems. But there are some basic principles at its core. The first of these is referred to as analytic art therapy. This school of art therapy is focused on analytical psychology and psychoanalysis. It is centered on the client and the therapist, and ideas that are transferred between them via art. Art psychotherapy is based on the analysis of the work of clients by a psychotherapist. And the third and final approach is known as art therapy. Rather than analyzing the art produced, this approach focuses on the process of creation itself. The tenets of art therapy involve humanism, creativity, reconciling emotional conflicts, fostering self-awareness, personal growth. Development of art therapy. Art therapy has a rich and lengthy history, but its establishment as a therapeutic approach was cemented during the mid-20th century. In 1942, the artist Adrian Hill first coined the term art therapy, having discovered and documented the psychological benefits of painting and drawing. The work of Hill influenced other professionals in the mental health field, and several of these began to describe their work as art therapy. As the 1940s unfolded, several influential figures emerged. Margaret Nornberg, Hannah Kwiatkowska, Florence Kane, Edith Kramer, and Eleanor Ullman have been recognized as pioneering theoreticians and practitioners in the field. Indeed, Nornberg is sometimes referred to as the mother of art therapy, and is usually recognized as the primary founder of the American art therapy movement. Norberg went on to write several influential books, including Dynamically Oriented Art Therapy, Its Principles and Practice, published in 1966. The artist Edith Kramer is also considered a founding pioneer of art therapy, believing that the approach could sublimate anger, anxiety, or pain. As a result of these pioneering efforts, art therapy began to be more recognized by the mainstream healthcare establishment, and national professional associations were formed across the globe in the second half of the 20th century. Today, diverse perspectives exist on the history and practice of art therapy, and the field can be considered both cutting-edge and evolving. Rorschach-Inkblatt test. The Rorschach test is a psychological test that can be associated with art therapy. The test is named after its creator, Swiss psychologist Hermann Rorschach. Although the Rorschach test has been widely used historically, it is controversial today, as many critics consider it to be pseudoscientific. Based on the perception of objects, the Rorschach test involved an inkblot being folded on a piece of paper, and for subjects to then describe what they perceive in the resultant pattern. The technique is intended to be a psychometric examination, and was widely used in the 1960s. Due to its artistic nature, the Rorschach test has been used in art therapy sessions, and some proponents consider the approach to be valid, particularly since the development of the Exner scoring system. However, critics suggest that the test lacks objectivity and verifiability, and also note that it can only diagnose a limited number of psychological conditions. How is art therapy practiced? Art therapy involves patients employing a range of creative techniques. Drawing, painting, collage, coloring, and sculpting can all be utilized, with the aim of examining psychological and emotional content in artwork. Art therapists use the nonverbal messages that are communicated through art in order to understand patients. Early sessions also involve speaking with a therapist in order to establish some important facets of the treatment. At this stage, what you hope to derive from the session will be established. Art in relation to mental health care. Mental health treatment with art therapy is a two-way process, with both therapist and client contributing to the treatment plan. As a client progresses through the course, she or he will then be asked various questions: how they feel about the process, what thoughts and memories came up, and so on. Art therapists believe that self-expression through artistic creation has therapeutic value for both healing and seeking deeper understanding and appreciation of oneself. The therapeutic application of art therapy in mental health care. Art therapy can be used as a standalone technique, but it is also often applied alongside traditional mental health treatment. Art therapy has achieved many successful interventions, thanks to its ability to manage behaviors and process feelings. The process of art therapy can be one of self-discovery for clients. The creation of art can help clients delve into their subconscious and deal with unresolved feelings. There is also often increased self-esteem associated with producing art, with clients gaining a feeling of self-accomplishment from the process. Art therapy has also been demonstrated to reduce stress, while the intervention can also provide a valuable platform for emotional release. The benefits of art therapy in a mental health setting have been widely demonstrated by an array of studies, and its practices and applications have grown as a consequence of its successes. Summary. In this module you have learnt: art therapy is a form of psychotherapy involving art. There are 3 different schools of art therapy. Art therapy addresses a wide range of disabilities and issues. Diverse perspectives on art therapy exist today. The artist Adrian Hill first coined the term in 1942. Margaret Nornberg is considered particularly important in the development of art therapy. A two-way process between therapist and client is important in art therapy. Art therapy is used alongside traditional mental health treatment. Art therapy has become a more common form of treatment in recent years.